We're going to hand over to Tamara and Diane, who led the work package around policy recommendations and lessons learned, and they're going to take you through that, and we'll have a short Q&A. So over to you, Tamara.
Well, the objective of this presentation is to present the lessons learned and the policy implications or recommendations on how to address the issues of scaling up using the experience of the 5 regions involved in the Scirocco project to facilitate the knowledge sharing in integrated care. How were the lessons learned and the policy implications captured? So we have used a qualitative approach, controlling focus groups, to collect the experiences of the 5 regions with the Scirocco tool. The 5 regions involved in the Scirocco tool have used, in the Scirocco project, have used the tool for different purposes. So the main 3 activities were the assessment of maturity of its regional context in integrated care, the assessment of the maturity requirement of the good practices implemented in its regional context, and the process of training and coaching among the regions. So the lessons learned from the focus groups were on the tool itself and the process of using the tool, the potential enhancements of the tool, and the future uses and the policy implications of the tool. In regard to the tool and the process of using the tool, we have learned that the Scirocco tool facilitates a constructive collaboration, a constructive collaboration between different professionals for the purposes of consensus building. The tool enables dialogue, which generates knowledge and promotes reflection on the object of assessment, either if it's a good practice or the assessment of the context. The Scirocco tool also provides support to make decisions or to present rationales to decision makers and policy makers with regard to integrated care. About the use of the tool, there has been some discussion or dialogue about whether the tool is easy or complex to use. This dialogue or this controversy, let's say, may be explained by the evolution of the Scirocco model and tool, which have suffered different iterations through the project. The purpose of using the tool is not the same using it for the assessment of the context that for the assessment of the good practices. The professional's knowledge on the topic or the object of assessment, and the familiarity with the Scirocco tool. About the potential enhancement of the tool, from the focus group has been come out that language was an issue when using the tool. This may be due to there is the need to conduct a cross-cultural adaptation of the tool, taking into account not only language particularities, but also cultural and contextual particularities when translating the tool. Some difficulties in understanding some dimensions has also been stated in several focus groups, and this may be due to language issues. Other enhancements of the tool stated during the focus groups were to make the tool friendlier at visual level and to offer fewer features, also to use brighter colors. And in regard of the future uses and the wider implications of the tool, stakeholders in the focus groups stated that the Scirocco tool can be used in a great diversity of organizations at different organizational levels and also with different stakeholders. Particularly, the Scirocco tool has been seen as useful when used at high organizational level, for example, from a strategic perspective, and also has been potentially useful in terms of determining areas of policymaking. Some examples of future uses of the Scirocco tool proposed by the attendees in the focus groups were to follow up on the progress towards integrated care or scaling up good practices, also to use the tool as a management tool for health and care partnerships, to be used in areas of change management, and also to use to develop digitalization strategies. So now we are going to speak about policy implications.
Thank you. And so, thank you all for being here. Wonderful to see you together. This is really the big picture of Scirocco that you've seen throughout the day and that you've seen drawn together in terms of the lessons learned put to you by Tamara. It's allowed us as a project and as a group to really come to and to reflect upon what the possible strategic directions and the policy implications of what we've been doing means. And that has allowed us to concentrate on three main key areas. They are the process that we've used in Scirocco. They're the actual Scirocco tool that you've seen in all its wonderful multicolored glory throughout the course of today. And it's also what Scirocco means for decision making. All the news has been very positive. We've been very transparent with Tamara, and we've just shown you a couple of the areas in which there were quibbles and there were questions and debates and dialogue. And I think that will happen with any tool and with any process. That's part of being a community and part of being a group of people who come to consensus together. But ultimately, what I'm showing you here with regard to the process, its constructive nature, its consistent outcomes, the way in which it builds collaboration, really facilitates group work and sharing, and really places the emphasis on twinning and coaching, which you've seen so beautifully expressed over the last session. For example, in the knowledge transfer that Puglia, purely as an example, brought to your attention. All this is very positive, very constructive. Equally on the tool side, it really reinforces what we say about Scirocco, that it's about readiness to take action on integrated care, and really helping people to understand the context in which they are working towards scaling up integrated care. But what we have seen, and I think we would like to explore with people further, is the fact that it can probably be used with wider groups of stakeholders in different settings and on different digital and non-digital futures. Last but not least, particularly the decision makers who were giving us feedback as part of the focus groups and part of the discussions, were very, very strong on the kind of reinforcement and reassurance that they receive when they see the results that come out of Scirocco. I remember Giovanni Gorgoni, for example, this morning, showing you that fabulous picture that said, okay, how are we going to bring together the ideas of the decision makers and the local citizens, and when they're so contrasting? But in fact, using Scirocco can really help groups of people come to agreement and come to consensus. It's really good on building evidence. Evidence building, and we've seen that through the evaluation that's taken place. It's got tremendous potential for helping with change management and for helping people work on the strategies in their local regions and more widely. Therefore, in policy terms, we've tried to simplify a little bit. At the moment, I'm going to run through 7 potential policy messages here. And I don't want to oversimplify, but we've used really kind of friendly, approachable language to say it's about getting ready. It's about speeding up in what we're doing. It's about using Scirocco, because Scirocco is out there, it's validated, it's tested, and we can really go forward in exploiting its use. And it's about using Scirocco in a context where you can look for the evidence, you can greatly support your arguments in your local region or in your nation with regard to what you want to do on integrated care. The final three are really about community building and capacity building. They're about working together, co-design, learning from each other, and really being willing not only to share our good practices, but to really support others in building their own good practices or to learning and adopting our own. You will be aware that something like 50 regions, 50 different sites plus have used Scirocco, the Scirocco tool, the Scirocco process. And you may or may not know that those were not just here on European soil. This also occurred, for example, in Canada. It occurred in New Zealand, Australia, Singapore, the US also. And therefore that region, knowing what we've been told by the World Health Organization about the massive international challenges in expanding the use of integrated care, we'd like to propose a more international scene and a more international perspective as well. The UN, the United Nations, has 17 very important sustainability development goals. One of those is extremely firmly focused on health. And therefore, as a result, a fundamental potential policy message is that Scirocco can not only help with you decision makers in your regions, in your nations, in Europe, but it can really help with the global societal challenge of providing integrated care to many more people, because it will really help and enforce and improve all our healthcare. And on that, I would like to finish our dual presentation, and we're open for questions. I'll move sideways. I'll sit down, I think.
Great, thank you, Diane. Thank you very